bone augmentation surgery is quite a long term for a very simple procedure. It is when you place implants or have any bone defects that you add additional bone to the existing bone of the patient. So for example, if you have a tooth removed, it's completely normal that in between 4 and 12 weeks, the bone, which is not needed anymore, resorbs and leaves like a small deficiency of the bone. So you have, for example, a tooth, then a tooth removed, and then tooth again, and between these two teeth, you have a little bit bone loss. And we want the implant to look like a tooth, so you add a little bit bone to reconstruct the original anatomy. That's what's called bone augmentation surgery. So you add a little bit bone to the existing patient's bone to have a bigger volume. This is always a tricky question, and fundamentally, it's just a different terminology for the same thing. Bone grafting and bone augmentation is the same thing, basically. Again, you add bone to an existing volume deficiency of the patient's anatomy, bony structure. The procedure is actually, the procedure is always the same. It depends on the extent of the surgery, and it depends on the situation we find. So you always start with either sedation, or in some other countries general anesthesia, but you always have a local injection making the area numb. Then you lift the gums from the underlying bone, because you need to see the bone where the defect is. And then in a very simple case, you drill for the implants, and if very little is missing, you use the bone which you have removed from the cavity where later on implants is placed, and add that on the outside of the implant. That's the easiest, smallest bone augmentation. If the defect is a bit bigger, you can mix that bone from the implant site with artificial bone. And if the defect is really, really big, you can either then take bone from one certain area of the lower jaw and transplant to that site. And if you have huge bone deficiencies, for example, after a cancer treatment or massive cysts in the jaw, where the entire bone is removed because it's cancerous, you can use bone from one of the bones of the lower leg and then transplant. And that is the biggest bone augmentation there is. There are other bone augmentation techniques, but this is more experimental now, where you can recreate bone, for example, through to genetic modification. If you put or create new bone in your shoulder, and in your shoulder muscle, or in the back muscle, and then transplant that bone to your missing bone. But the most normal procedure is you either the smallest bit, you use implant bone from the implant cavity and put it on the outside of the implant. We then can mix it as well. If the volume deficiency is a bit bigger, can mix them with artificial bone, or you have to harvest bone from a different area of your body. The materials, you have all the materials you can use, from ceramic materials, which are not that good because they don't heal that well, to material from bovine origin, coming from cows, pig material, porcine origin, horses, and you can even have material from humans. So whatever material is available, you can use. Normally, if you do the surgery well, it is not very painful. The most important thing is that you do the surgery not fast, but quick, because the shorter your surgery procedure, the less complications you have, and the less pain. And normally we have pain managing procedures. So before the surgery, you already take painkillers and antibiotics, especially if you have big bone augmentations. And then, of course, after the procedure as well, you have every 4 hours ibuprofen and or paracetamol or cocodamol or other painkillers. But it's very important that you have, for the first 2-3 days, a constant pain management regime. And then normally, yes, swelling is very likely, but pain, normally, if it's a managed procedure, you should not have too much pain. And the good thing is medication like ibuprofen at the same time reduces the risk for inflammation. So it's not just a painkiller, it reduces risk of inflammation. So if you do a bone augmentation together with an implant, it is not a very, very painful procedure. Not during, because you have local anesthetic or sedation or a GA, and after the procedure, not because you have a constant pain management regime for 2 or 3 days. And the worst day is the second and the third day, and after that, the pain is going to go anyway. The recovery time after bone augmentation, of course, depends massively on the extent of bone augmentation you have done. If you have a small defect, for example, you have an implant and just a tiny bit bone missing on the outside, you'll take 2 or 3 days and you'll be fine again. If you have a bigger augmentation, the issue is not the bone augmentation itself, because bone itself doesn't have nerves, the bone itself does not hurt, but you have to cut the skin of the bone to make the gums more flexible, to be able to cover the volume deficiency of the bone. And this cut and the associated swelling, that can cause problems. And the worst day after the operation is not actually the operation day, it is the second or third day after the operation. That's the worst day. This is the day when you have the biggest swelling, the biggest pain, the biggest discomfort. After that, it will go down again. So approximately after a week, you're pain-free, swelling has gone down moderately, and latest, depending if you have really a massive bone augmentation, latest after 2 weeks, you're completely okay again. It is important to assist the healing process with painkillers, inflammatory suppressants, like ibuprofen, for example, and antibiotics. And this combination always helps to reduce swelling and the inflammatory risk quite significantly. So worst day after bone augmentation is 2 or 3 days, and after that it goes down. So the swelling goes up 2 or 3 days, and after 2 or 3 days it goes down again, and you'll be fine again after a week, completely fine again after 2 weeks.